Hey everybody, Coach Josh here. Hey, I talked with you guys a couple weeks ago about putting together a video that would show you how I might scale or modify for exercise for individuals. And one of the things about working out in a gym setting that runs group training is that sometimes people feel like it's a one size fits all plan, and it's just really not. Most individuals don't come to us with a clean bill of health right away. The other thing is injuries pop up, not necessarily even in the gym. A lot of times people wind up getting hurt outside of the gym. They get hurt moving something at home or reaching back into their back seat of their car, and they end up straining something. So not that no injuries ever happen inside the gym, but a good majority of things just happen in life. And so most individuals are just not overly like just perfect health individuals when they come to us. On top of that, as people train, strains happen and sprains happen and different things like that. So, but one thing I wanted to show you guys is kind of how we might scale for individuals based on injuries or based on fitness level. One of the things that maybe separate us a little bit from different gyms, from other gyms in the area, is that my background as the owner and the head coach is I have a degree in athletic training. That's not a degree in training athletes. That's actually a degree in sports medicine, in evaluation, diagnosis, and treatment of athletic injuries. And so I worked in a physical therapy clinic for about 6 years prior to opening up my gym. And my number one job for the physical therapist was to actually activate physical therapy patients into a fitness program while they were in physical therapy. And the whole intent was that to develop their overall body fitness and health and strength while they were rehabbing maybe an injury. So the whole idea of just taking time off after an injury, not that that's never needed, but for the most part, we're able to work through exercise programs with our clients, even though they might be rehabilitating an injury or have something going on. So I just thought I'd put a little bit more specifics to what I talk about sometimes in some of our videos, and I'd give you an exact way that I've modified an workout program for our clients this week. So the workout itself, it was the prescribed workout was a 13-minute AMRAP, 200-meter run, 15 box jumps, 15 push-ups. One way that I'm going to first give you an initial scaling is maybe just scaling back for the individual that is developing their fitness a little bit. So they're a healthy individual, but they're maybe newer to what we're doing, or they're just not quite at that prescribed level on the workout. And so we might do a same style of AMRAP. I actually love AMRAPs for someone who is newer to our CrossFit world because I just set the amount of time they're going to work, and they determine how much work they get done in the AMRAP. So I really love AMRAPs for that. It keeps the intensity down a little bit for somebody, and it just lets them work within their comfort range. So the AMRAP style, the time domain, I'm going to keep that the same. It's not a super long time. What this means is that means as many rounds and reps as possible. So I'm going to have the clock set for them. Hey, it's 13 minutes. Just get as much work as you can done in the 13 minutes, and then I'm going to take your total rep count there after that. 200-meter run, it's a short run, so I'm going to keep that run the same. 15 box step-ups. We might be modifying to a box step-up because maybe that person's not quite ready to do box jumps yet, or we could lower the box down to even a couple plates just to get them jumping off the floor. Cool. Just depends on that athlete. And then 10 to 15 knee push-ups instead of going from a full push-up position. Push-ups typically are one of the exercises that challenge us most in high rep amounts. So this would be 15 reps per round. Say that person was going for 13 minutes and most of our clients did around 5 to 6 rounds. That's a lot of push-ups in 13 minutes. So we might scale the amount of push-ups they're doing down to maybe 10, and we're going to scale it down to a knee push-up instead of a full push-up as they're developing their upper body strength. All right, so then I'm going to give you 3 scales for injured individuals. So client 1 here, client 1 has a hernia. Client 1's going to get that hernia repaired in another couple months or so. But right now, we're just trying to keep them active. They're okay with it. Doc's okay with it. And so we're going to let them just stay active. And then based on their comfort level, we're going to scale and modify exercises as they need to. So AMRAP time is going to stay the same. This client, when they run, it jars that a little bit, and they don't really love it, so it's not super comfortable for them. So they're going to row on our rowing machine instead of running in the workout with the same distance. Box step-ups, same type of thing. They don't like to jump because the jarring and the landing irritates that, so they're going to do a box step-up. And then they're going to do 15 dumbbell bench press instead of a push-up. So they're going to activate the same muscle action in your butt instead of being in a plank position, which is making them activate their core more, which is putting more tension on that hernia. They're going to lay on their back on a bench and do a dumbbell bench press. Client 2, lumbar disc issue. This is a client that maybe has, they've progressed through a rehab protocol for a while now. They're a little bit further out from the initial injury. So there are some things on here that you might think, well, as a clinician, if you're looking at this and you say, well, that's not quite what I would do there, understand that we're in compliance with everything their clinicians are running on a rehab standpoint, and we're a pretty far way down the process here, and we're still checking in with this client on a regular basis based on symptoms. So AMRAP staying the same. They're not running or rowing yet because of their injury, so now what they're doing is they're going to do an Airdyne bike. A 0.2 mile Airdyne is going to be equal distance to the 200 meter row. So that's kind of a conversion that we've made on our own, figuring out how long somebody's taking on an Airdyne bike versus a row or a run. 15 box step-ups might make a lower box because we don't want that client getting into full kind of knee flexion coming up and putting a little bit more flexion on the lower back. And then 15 knee push-ups. Puts them in a good plank position. They're actually working on activating their anterior core, which is going to be important for them actually developing from this lumbar issue. So they're able to do those 15 knee push-ups without any symptoms. Client 3 has a shoulder issue. Well, we got 15 push-ups in the workout. How are we going to do that with a shoulder issue? Well, we're going to modify what kind of upper body routine or movement that we do here. So client 3 has same time on the AMRAP, 200 meter run. They can run with that shoulder, no issues there. 15 box jumps. Again, it's just a shoulder injury. They can still do box jumps with their lower body. No big deal there. They're not making big arm swings though. And then we need to just keep that client below the shoulder right now, and we need to avoid pressing activities because pressing activities causes symptoms. So we're actually going to sub out the push-up for a ring row. So it's basically the opposite motion of a push-up. Instead of doing a push out, they're going to do a pull to. That's also helping develop their upper back strength and their scapular strength there, which is going to be beneficial to them as they're actually healing up from the shoulder issue. So, prescribed workout, a scaled workout for a healthy individual, and then 3 different injury modifications. The other thing that really separates us probably from other systems is the training app that we use. We use an app through a company called Train Heroic, and that allows me to manipulate individual client details in their workouts. So right now, I handle all of the scaling for all of our injured clients. So at the beginning of the week, I sit down, I take a look at our programming, and then I modify all of the exercises we need for that client as they're going to see the workouts. So they get the workout on their phone. And instead of it saying the actual CrossFit workout that they might be doing today, it says it's from Coach Nimmo, and it says what their scaling and modification is. And then our coaches at the class that they're at, even if I'm not there for that class, our coaches know exactly how that client's scaling. Now, our coaches still sometimes have to make adjustments on the fly based on how a client's feeling that day, based on their injury or whatever it may be, because based on symptoms, sometimes symptoms change. But our clients get their scaling modifications right on their phone, and so they don't have to worry about guessing. And what we've found is it gives clients they are more confident coming into the gym, because sometimes if they don't have that, they might see an exercise or a workout on the protocol that says they're doing this and like, ooh, that might hurt my injury. Well, with me kind of being proactive and putting in their scaling ahead of time, now they're comfortable in knowing like, oh, I don't have to do that. Coach Josh has something set up for me separately. So that's kind of a benefit to being one of our clients. The whole point of group coaching is coaching. You're doing it in a group setting, but we're still able to manipulate individual training protocols based on what a client's needs are. So that's just something really cool that we get to do as a coaching staff with the systems that we use. So hope this helps. Hope this puts a little bit more pen to paper here. And so you can see it's not just podunk stuff. This is actually what I've done for a few clients this week. And we probably have a few other ones that I could put up here as well. So hopefully this helped for you coaches. Hopefully it gives you some ideas on scaling. For you athletes, hopefully it gives you a little bit of confidence and understanding on you can work out with injuries, but you got to have the right coaches in place to help you out with that. Thanks, guys.